Congenital nasolacrimal duct obstruction is a fairly common presentation to ophthalmologists as well as pediatricians. The effectiveness of a correctly done lacrimal sac compression or massage has already been described in literature. However, multiple ways of doing the lacrimal sac compressions are seen in practice, of which most are incorrect. Through this video, we intend to demonstrate the common incorrect techniques done by parents and demonstrate the effective and conventional technique to be adopted in a child for resolution of congenital nasolacrimal duct obstruction. Classically, Krigler had suggested the technique for compressions, which included these salient points. The pressure must be applied over lacrimal sac and the finger should be placed in such a way that it does not allow secretions to come into conjunctival sac. That is, the canaliculi are also obstructed while doing the massage. The pressure over the sac should be directed in such a manner that it causes the retained fluid in the sac to burst open the membranous obstruction in the nasolacrimal duct, thus causing resolution of congenital nasolacrimal duct obstruction. Let's have a look at the common wrong techniques which the patients follow. Some patients are seen pressing over the root of nose. Some patients are seen doing gliding movements along the nasojugal fold. Some patients can be seen pressing below the medial canthus. Circular movements along the medial and the inferior orbital rim is also commonly seen. Notice that in all of the above methods, the ultimate goal of increasing the intra-sac pressure is not achieved. Now let us demonstrate the effective technique of lacrimal sac compressions. First step is to hold the child firmly either in mother's lap or to make him sit comfortably in the parent's lap. Make sure that the head is stable. Now use your index finger to start the compressions. Feel for the edge of bone next to nose and below the eye, and using firm pressure, gently press towards the nose in a manner that your finger slightly dips into the gap. Care should be taken that you don't compress over the eye. These compressions should be done for at least 10 times per session with 4 sessions in a day. A crying child should not be a cause for not performing these compressions. Another good way is to demonstrate the technique to the parents on themselves. The finger should be placed on the bone edge next to nose and below the eye, and with gentle force, pressure should be applied inwards, nasally and downwards over the sac. Finally, the parents should demonstrate the technique in front of you so as to confirm that they have understood the technique. There is enough literature supporting the efficacy and cost effectiveness of simple lacrimal compressions aiding the resolution of congenital nasolacrimal duct obstruction. Classically, it has been advocated till age of 1 year, but in a recent study by Ali et al., the proper technique has shown efficacy beyond the age group of 1 year also. In conclusion, the correct technique of lacrimal sac compressions can go a long way in treating congenital nasolacrimal duct obstructions and also avoid invasive interventions. Thank you for your kind attention.